This is a quick overview for Diacare Pluse. In designing this program, we aimed at 3 goals: to make the program as friendly user as possible, to make the data entry as quick as possible, and data retrieval as easy and efficient as possible. So let us have a tour in this program to see how did we achieve these goals. This is the home page of the program with a list of today's reservation, with the booking time, the patient names, the type of visit, and the arrival time of each patient. On the left hand side, you can add a new patient, find a patient, do booking, calculate the risk factor for a particular patient, and generate some reports. In the lower part are tools to help us to customize this program for individual users. When we double click on the name of a patient, we will see the main page of the program where the patient profile, his diabetes status, his risk factors, the complications and comorbidities, the referrals, and his targets are displayed. In this program, we can navigate from one screen to the other just by clicking on the name of each page. The upper part is common for all screens, where we can find the patient's name and his ID and the date. This button helps us to get a quick report for the patient whenever we want it. And this button takes us to the gallery, where we find list of abbreviations of the terms used in this program, the normal range of the different biochemical parameters, and handouts which can help us in educating our patients. We can go, for example, to the drug history page, where we can see the drugs on which the patient was on before being seen in our clinic. And then the lifestyle, where we can keep tracing the different parameters in the lifestyle and the progress of the patient through the time. In the follow-up page, we have, like all pages of this, most pages of this program, we have an upper part for data entry and the lower part for data display, so that whenever we are entering data, we can keep an eye on the lower part, tracing the progress of the patient in different parameters. This is the annual visit page, the clinical note page, the lab result page, for example, where all the important standard parameters for following up a diabetic patient are registered and displayed with the timing in the lower part. This is the imaging and ECG page, where the different investigations done for the patient are registered with the date and the brief comment on the positive data on this particular investigation. Then the problem list, where we put the patient diagnosis in a problem list form with active problems and inactive problems. There is a treatment page in which we can prescribe drugs for the patient. Insulin has got its own input part, and other drugs have their own input part. All drugs are displayed in the lower part like other screens. There is the recommendations, where we put the recommended date for the next follow-up visit, and the next hemoglobin A1C test, and the next annual visit. Also we can have requests for lab tests and investigations to be done by the patient. Then in the prescription screen, the prescription is generated with the patient name and ID and the date. In the lower part of the prescription are the dates of the next hemoglobin A1C and annual visit and follow-up visit. We go back to the home page. If we want to search for a patient, we can search for him by any of these parameters. We can book for new patients or registered patients through this window. And these are the available reports: the financial report, the analytical search report, and the individual patient report. In the system parameter, we can individualize the program for different users so that every user can put down his own menus the way he likes it. In the data transfer, we can transfer data between different users by importing them or exporting them so that we don't have to re-input data many times. This concludes our quick overview, and every screen will be discussed in a separate recording. Thank you.